back here on Healthy Living with our friend Kelli, and we are talking, because it is Heart Month, about hearts. And in the first segment, we chatted a little bit about just getting established with a cardiologist and when is appropriate to come in and maybe from a proactive point, meet someone and have someone in queue in case you ever need someone. Let's talk, if we can, a little bit more about an emergent case. So I'm at home, someone I love is at home, and they start feeling chest pain. Take me from there. I'm going to call 911.
Right, so we can call 911. That ambulance is going to get you to the emergency department. And from there, the emergency physicians will take over your care. And then typically, if it is a cardiac related thing, they are going to consult a cardiologist. From there, we decide what may need to be done. So at Hilton Head Hospital is where we have our cath lab. So that is where we take care of any intervention they may need, whether that be
what does that mean?
A pacemaker.
Okay.
So that means that something is going on within the heart, and we have the physicians and the team that can go in and intervene with whatever problem that may be.
Oh, wow.
So whether that is an electrical problem where we need to control the pace of the heart, that's where the pacemaker comes in, so that it makes that rhythm a little bit more regular, so that we can feel better, so that you don't feel like you're going to pass out, that sort of thing, so that the body can function properly. Whether that's a blockage where they need to go in with that catheter and open up that blockage, and we have all sorts of different ways and to make sure that we do that the best and most effective way for that patient. And then beyond that, if we get to the point where that intervention is not going to work, then we have our cardiothoracic surgeon.
And talk to me about what the cardiothoracic surgeon does. What are the procedures involved in that?
So that is where our open heart program comes into play. So if we have a patient where they either have too many blockages for stents to be placed and it no longer becomes safe to place that many, or if it's that specific left side of the heart where it's just too crucial and they can't place anything there, it's just, like it becomes too much of a threat to the life, then we bring in that cardiothoracic surgeon, and that's where they take a look at that to see if we need to open up that heart and go in for that bypass surgery.
And these kinds of interventions aren't always at all hospitals. This is pretty much a specialized field that we're really lucky to have here in our Lowcountry.
Yes, that is true. We are the only hospital that does offer that full range of cardiac service, from the intervention all the way to that open heart if it is needed.
Why is that so important, Kelli?
Because it's all about time under pressure, right?
Okay.
When you are in that emergent situation.
The golden hour, I keep hearing.
Right. So we're in that emergent situation and we are looking at what we need to do. We can complete the step here so that you don't then have to be shipped out and have that extra time in there for someone else to then intervene and finish taking care of that patient. We are able to keep it all and get it all taken care of within that very timely manner.
One of the interesting things I think that you shared with me too is that you sort of navigate the system through cardiology too. You're not necessarily left to your own devices. You've got a pretty streamlined system where you can actually get through to the people that you need pretty seamlessly.
Yes, everybody is on staff. Everybody works together with each other so that one physician calls the next physician and everything happens so that that patient, that lack of care is not there. We make sure that that is a seamless, full range of care for that patient.
What's really interesting also is from my experience, cardiology patients, when they come into the emergency room, are treated and expedited pretty quickly. They're triaged right away.
Absolutely. There is a triage system when you come into any emergency department. Based off of the symptoms that you're having, you get placed in that tier, and that depends on how quickly you get taken care of. And that tier is often dependent on how life-threatening your situation is. So if it is a cardiac event where you run that risk of you know, of death a little bit more quickly than, you know, a broken foot or something of that nature. You know, it does get prioritized.
You know, with February is Heart Health Month and Women's Heart Health Month too, it just makes us more aware that we do have control of our health.
Absolutely.
I mean, we really do. Let's take a quick break. Come back. Got a lot more to talk about, so stay with us here on Healthy Living.